This is an introduction to a healthcare model called integrated medicine. In the following program, we will give an outline of the principles of naturopathic medicine and describe the practices of naturopathic physicians and their role in integrated medicine. Let's start by looking at health and the way we function. We all function on multiple levels: physical, mental, emotional, energetic, and spiritual. Optimal health is a high level of harmonious functioning on all these levels simultaneously. And poor health is a decrease of function due to accumulating interference from mental or emotional disturbance, internally or externally derived toxins, structural stresses or strains, deficiencies or lack of essential nurturing, or due to acute poisoning, injury, or trauma which pushes us into the disease zone, flat on your back, broken down. Thinking that if I'd only known I was going to end up here, I'd have taken better care of myself. Our current healthcare system focuses on this disease zone waiting for breakdown, and then relies heavily on drugs and surgery to try and restore function. However, restoration of optimal function often requires more than drugs and surgery. It also requires removal of deficiency by supplying all vital nutrients, release from structural interference, release from toxic buildup by detoxifying procedures, reintegration of conflicting mental and emotional patterns to allow for better internal and stress management, as well as the teaching of healthy habits to maintain health so as to avoid poisoning, injury, and trauma. This total approach to healthcare is integrated medicine, the healthcare system of the future. Doctors of the future will practice integrated medicine by identifying and removing interference, restoring harmonious function on all levels while educating patients to maintain optimal health in harmony with nature. Where are these doctors of the future? Naturopathic medicine. Naturopathic physicians are general practitioners with specialized training in natural therapies. Naturopathic physicians are trained in the conventional medical sciences to diagnose in a manner similar to medical doctors, but they're also trained to recognize and treat functional conditions that may precede or be a consequence of a disease. Qualified naturopathic physicians have taken at least 3 years of undergraduate university study and completed a 4-year training program at a recognized naturopathic college. Additionally, state or provincial licensing examinations may be required in order to practice. Naturopathic medicine's techniques include a blend of modern and traditional methods. Certain principles underlie the practice of naturopathic medicine. The healing power of nature. The art of healing comes from nature, not from the physician. Therefore, the physician must come from nature with an open mind. First, do no harm. Utilize methods and medicinal substances which minimize the risk of harmful effects. Avoid, when possible, the harmful suppression of symptoms. Whenever possible, use non-invasive techniques to diagnose and treat illness. Identify and treat the cause. The naturopathic physician seeks to identify and remove the underlying causes of illness rather than to merely eliminate or suppress symptoms. Treat the whole person. Health and disease come from a complex interaction of forces. Naturopathic physicians treat each individual as a whole person, taking into account physical, mental, emotional, genetic, environmental, social, and other factors that are affecting the individual. Prevention. Naturopathic physicians emphasize the prevention of diseases, assessing risk and early intervention to prevent minor illnesses from developing into more serious or chronic degenerative diseases. Doctor as teacher. Naturopathic physicians educate the patient and encourage self-responsibility for healthcare, at the same time developing a cooperative doctor-patient relationship. The practice of naturopathic physicians. Assessments in naturopathic medicine. The purpose of assessments is to identify or diagnose any emergency life-threatening condition, the degree of tissue destruction or pathology that may be present, and measure the functional conditions that precede or are a consequence of disease. Assessments are done to determine appropriate treatment. Naturopathic physicians cooperate with other branches of medical science, referring patients to other practitioners when appropriate. Assessments are based upon history taking, consultations, examination, which consists of physical examination, laboratory examination, X-ray, and biofeedback. Treatment in naturopathic medicine. The purpose of treatment is to remove interference in order to stop the degenerative process, strengthen and maintain current levels of function, and regenerate the person to higher levels of function. Therapies in naturopathic medicine are derived from the sciences of clinical nutrition. Many conditions can be treated as effectively with foods and nutritional supplements as they can by any other means, but with fewer complications and side effects. A growing body of scientific knowledge is validating this approach. Homeopathic medicine. This powerful system of medicine is more than 200 years old and is widely accepted in other countries. Even the royal family of England uses the services of a homeopathic physician. Homeopathic medicines act to strengthen the body's innate immune response. Some conditions that conventional medicine has no effective treatment for respond well to homeopathic medicine. Botanical medicine. Many plant substances are powerful medicines, with advantages over conventional drugs. They are effective and safe when used properly in the right dose in the proper combinations with other herbs and treatments. A resurgence of scientific research in Europe and Asia are demonstrating that some plant substances can be more effective than synthetic drugs in clinical situations. Naturopathic physicians are trained in both the art and science of botanical medicine. Physical medicine. Physical medicine includes, but is not limited to, manipulation of the muscles, bones, and spine, physical therapy using heat and cold, electrical pulses, ultrasound, diathermy, hydrotherapy, and exercise therapy. Oriental medicine. Naturopathic physicians are trained in the fundamentals of Oriental diagnosis and treatment. Many practitioners use acupuncture, acupressure, and Oriental botanical medicine in their practices. Counseling and stress management. Mental attitudes and emotional states can be important elements in healing and disease. Naturopathic physicians are trained in various psychological techniques including counseling, stress management, hypnotherapy, and biofeedback. Naturopathic physicians may choose to specialize in one or more of these areas. Just remember, if you wear out your body, where are you going to live? Integrated medicine is the medicine of the future, and naturopathic medicine is an integrated approach to health care now.